right. Hello. How's everybody doing today? Dr. Amanda Lynn, a little more on the casual side today, but I'm going to be more professional with my presentation here today. This one, I just, had time to do it, but sick and tired of not eating what you want. I mean, of course, America, we eat too much of the bad foods. So the sugars, alcohols, etc. Yeah. But, in moderation, everything. But, stomach pain is a real struggle for sure for many, many of my patients. And so I want to kind of help shed some light today on what some things can be done. So I'm going to share and pull up my slides. I'll share the screen with my Google Chrome. No, how am I going to do this? Ooh, I could do this where we share the screen first here. See, I would love for you guys to meet Beth. Beth came to me after over a year and a half of struggling immensely. Look at how sweet and cute she is. She flew up here from San Diego hearing about me through family and saying, you've got to just come up here. And so she literally had one visit with me, but I could tell with her story how she was talking, how she had reacted to some of the medications and things she had tried with the MDs in the pathway. And just a really good history and physical intake, was able to determine that she had quite a bit of dysbiosis going on, a lot of the bad bugs, specifically some candida and yeast. And we were able to get her feeling better in 7 days. And she continues to get stronger and stronger, as she'll show you here. But it was a real testimony to how my program just even like come in quick and go. We didn't have time to do food sensitivities and allergies as much with her, but I did look at her candida and the different bugs that we wanted to verify. I wanted to make sure that that was the case and what I was going after. She had a lot of neurological issues going on too. And these are things that aren't talked about a lot, but when your gut's off, you'll get bogged down in the nervous system, your brain, memory. We have too much inflammation, right? So I'll let you hear from Beth.
Oh my God. Dr. Amanda, she's done for me. I spent about a year and a half ill, sick in my stomach, unable to sleep properly. I just was a basket case and even became depressed about it because I couldn't find anybody that would help me. I went to doctor after doctor to no avail. Nobody was able to pinpoint my diagnosis. They diagnosed me with this and diagnosed me with that. It was never the right diagnosis, and I never got the proper treatment until I was referred to Dr. Amanda, who, by a friend, who was absolutely a miracle worker for me. I went in, I spent the time for evaluation with her, and within about 30 minutes, she had diagnosed me and felt that she was sure and pure with her diagnosis, but she went ahead, ran lab tests and whatever to confirm that diagnosis, and came back and sure enough that she was right. And I was able to follow her plan and take all of the wonderful things that she gave me and make it a lifestyle. And that's exactly what I did. I followed her plan and made it a lifestyle, and it has completely changed my life. I am no longer tired. I can eat what I want, although I try to eat pretty pure and keep it to a healthy lifestyle, because that's part of what this all requires. It's been about a year, a little over a year since I saw Amanda last, and because I actually live in California and she's in Oregon, and I would say I'm healed. And I continue to follow her program. I want to thank you for listening to me, and I hope she can do everything for you that she did for me. Bye-bye. Hi, I'm here today to talk to you about Dr.
Do that again. All right, you guys are all struggling with me learning all this stuff here, so I will not mute myself. I hope you can all still hear this. Okay, great. So stop share up here. Perfect. Great. So Beth, what a sweetie. She totally volunteered that, consented to releasing her information there, and I'm really grateful if she could help out with that. Sorry for the noise in the background. I'm doing dishes. So funny. All right. So another share I want to do for you is on my files. See if we can find this. Going to, nope, nothing to share here. Sorry, guys. As I figure this out, I want to share maybe my screen. That should be doable, right? Of course, I did this beforehand and it worked fine, and now it's not. Who can share? Only hosts. There we go. That's probably a good idea. I will hopefully be able to pull this out before. Let's see, maybe there's some more over here. I'm going to share my basics. And I think I should be able to share my desktop. There we go. That's what it is. Share my desktop. So on my desktop, I will need to show you. Oh, I was trimming that one up for everybody. Don't you love this? Like I'm gonna have to do with this one. All right, cool, here we are. Okay, bulletproof your gut. So, can you all see this? I'll try and move my little, there you go. Bulletproof Your Gut by Dr. Amanda Lynn. This will be great for me. So I'm a naturopathic physician. What is that? I've got a whole YouTube on that one for any of you who aren't aware. Here in quite a few states, we are trained like primary care physicians. So we have dual training, a standard conventional medicine. I can write scripts, do all the exams, do all the ordering, all the lab orders, have my DEA number for the testosterone and different pain prescriptions, this kind of thing. So totally legit on all those fronts. But during our schooling, we focus a lot on the function and the optimal health. So we are the original functional medicine doctors. I have a thesis on connective tissue and a healing focus on Marfan syndrome. So the GI tract is just connective tissue. So it's really exciting to kind of share this over. Of course, it is very much its own system, which we'll find out more. 10 years as a primary care physician, moving and guiding hundreds of my patients through this exact protocol I'll be sharing with you today. And then my own continual struggle with a leaky gut due to my connective tissue disorder. And do some spelling checks while I do that. Marfan syndrome is what I have, and my family, who is currently getting discharged from the hospital today. Yay! First one in my family to have a aortic root tube added on without having to replace a valve. So she does not need to be on Coumadin. So very excited on the advancements that are happening for us. All right, so always the basics. I'm a teacher here today. Your gastrointestinal tract starts in the mouth, right? We've got to chew. You probably heard the 30 times, right? Wow, lots. It's important to be in a calm environment when we're eating. Kind of hard with little ones. I totally get that. So you can totally just be in a mindset of being calm and grateful and reducing your stress. There's so many hangups on foods these days. People don't know which foods are good for them, which foods are bad for them, is it's too high of fat, too low of protein, and everybody's getting these pre-recorded things before they even sit down and eat, and it doesn't seem to contribute to healthy eating. So whole foods in a calm environment is going to be your best way that you're chewing to take in the best diet. Of course, everybody's going to have some specifically different things, but prevent those guilty bad feelings from coming up while you're eating. Distraction if you need. Digestion starts in your mouth. And there are, did you know, very specific probiotics or happy, live, healthy bugs that live in your mouth, as well as your sinuses and our nasal cavities, all the way down into the beginning of the bronchial tree of our respiratory tract. Continuing to learn about these amazing microorganisms that are symbiotic with our body. I'm sure we're going to find that there's a lot more places these guys live. But luckily, most of us are on board together that they do fill up our GI tract. The old med school books, the MDs, even the gastroenterologists were told that the GI tract was sterile. That was definitely not accurate. So it's really awesome to be in a field that stays on the front of medicine and the science, which us naturopathic physicians and functional medicine doctors are doing. We don't have to wait for the AMA to figure it out too and then say it's okay. But we, of course, look at studies and science. Sit, chill, chew, and be happy, repeat. And those are going to be your guidelines for eating. Awesome. The kids are in the background, as you can tell. We got to do what we got to do. I'm watching my niece. All right, your stomach is very accustomed to high acid. It loves high acid. I don't want that in other places of your body, like not in your blood, but in your GI tract. That's what you want, and that's what bugs like lactoacidophilus really, really thrive in. So you need these high acid to, one, absorb the minerals that we need to build our connective tissue. My Marf's talking to you there, but all my other patients, I see everybody deficient in minerals. And this could be a big reason why right here is these natural juices are starting to reduce more and more, just with all the toxins and exposures that we have. And so I find that even something as simple as like your children having a pickle beforehand, a little lemon water, and the old school way was definitely a little sip of apple cider vinegar. But this does not guarantee the proper pH, as I'll talk about here. So another thing that you need to absorb and to make sure is happening with that acid is that you need B12 to get absorbed. How does that work? Intrinsic factor needs that high acid in the stomach, and then it goes into the small intestine, and then it will help that second process of actually absorbing B12. So it's about a 3-step process to absorb B12, hence why a lot of people need to actually just get shots or do sublingual if their GI tract's been not so happy for a while. And then I worry about osteoporosis or poor connective tissue. Women, our estrogen levels definitely are connected to our acid, and that estrogen stimulates your hyaluronic acid to be released. So postmenopausal, this is really the reason for osteoporosis. This is so important time for you to start paying attention to the need for addressing this pH in our gut, and possibly just taking a betaine hydrochloric acid supplement wouldn't be a bad idea. Just because the apple cider vinegar does not guarantee it will get all those pockets in our GI tract that need to be very acidic. That's thanks to Emily Ganaway, a doctor you should totally follow on Instagram. Great